In Uganda, the COVID-19 pandemic has accelerated the incidences of mental illnesses, especially among the youth. This is because the COVID-19 pandemic has impacted the youths negatively in different ways, including loss of parents, jobs, livelihood, but also continued closure of schools has caused anxiety and depression. This is being evidenced by the high number of mental illnesses currently recorded at Butabika National Mental Referral Hospital.
We also do community outreaches as Butabika Hospital and go out to different communities so that our patients don't have to come here, but we can actually go to them and give them treatment. We also supervise regional referral hospitals, so we actually visit regional referral hospitals at least once every 4 months to find out what is happening there, to train, to support our technical teams that are there in trying to address issues related to mental health.
Minister of State for Health in charge of general duties, Anifa Kawoya, considered that the problem of mental health-related illnesses is becoming a big challenge to Uganda's population, with 60% of people affected.
You can be traumatized because you have been tortured. You can be traumatized because of the environment you are living in around you. You can be traumatized, for example, like this time of COVID-19 also is one of the issues that is causing high traumatization within our society, and different sicknesses, of course. So traumatization needs much care. Needs much counseling.
Government is now in advanced stages to establish a center of excellence at Naguru Hospital in Kampala to provide comprehensive services related to mental stress.
The trauma per se in this country is the third leading burden of disease in terms of admissions in the country. And as a result of this, there has not been a very good system of handling trauma cases, especially the referral, and the setting up of centers, especially to attend to trauma cases. Previously, we had the accident and emergency centers, and these are going to be improved through the training of specific staff for this particular department, an outpatient department, and also this translates also from the district up to the national level.
According to Butabika Mental National Referral Hospital, the number of youths presenting with mental illness is increasing, and according to UNICEF report of 2020 titled The Impact of COVID-19 on Mental Health of Adolescents, 40% of the youths affected do not access treatment or rehabilitation services.
So stigma is quite a big challenge, lack of knowledge and information, and you know that actually increases the stigma. There are many myths and misconceptions that people have about mental illness. You also realize that another challenge we have is the human resource for mental health. You'll find that there are very few psychiatrists, very few psychiatric clinical officers, very few counselors. The need is big, but the number of people who can offer services are limited.
The youths are, however, advised to share their challenges with family members, since some of mental health challenges, especially those imposed by the negative impacts of COVID-19, can be managed by continuous counseling.
And solving that can be through counseling, just talking to someone, showing them love, care.
Some humanitarian organizations like BRAC Uganda are helping the youths in business recovery by supporting them with the incentives to revive their businesses that had collapsed due to COVID-19 induced lockdown.
But now I'm going to be given another sewing machine. Now we'll be having 2, which has brought improvement and expansion in my business.
I'm doing catering and fast foods, and I've been supported with a machine and cooking oil to expand my business.
COVID-19 pandemic is having far-reaching consequences to the mental well-being of the population, and government needs to work with other stakeholders to ensure that the people are helped to overcome some of these challenges. Reporting for UBC News, I am Juliet Naiga and Sarah Natolo.